Thanks very much.
No worries.
So we are here in the ambulance bay, which abuts the emergency department of the Royal Children's Hospital. And this is where the journey begins for so many of our patients. We're talking about one of the busiest emergency departments in the world. This place sees 77,000 patients every single year. Yesterday, we saw 264 patients. That's more than 10 an hour. Now, procedures is part and parcel of every single day in the emergency department. We're doing things like IV drips, lumbar punctures, we're stitching up lacerations. All of these things are extremely, extremely distressing for patients and also for parents as well. Now, being a father, it doesn't make it any easier causing pain and distress to some of these patients. It's something that we grapple with every single day. Now, I'm going to be joined by Dr. Elliot Long, who's one of the consultants in the emergency department. Elliot, thanks for joining us. What is it like being a father and also being an emergency department doctor where you have to perform these procedures on kids every single shift?
It's a little bit like being a vet in that you feel like you're doing something helpful for the patient, but that something is painful and they don't understand.
And what kinds of things do you have as tools to help you and help the nursing staff through these procedures?
I guess everything from distraction to medications that make them drowsy or help to make their memories not too nasty.
Terrific, thank you very much. So we have procedure rooms that are scattered throughout the emergency department for things like plastering and any of those procedures that we mentioned before. And the best form of distraction, or best form of analgesia rather, is non-pharmacological, which means distraction. And I'm joined here by Rachel, who's one of our educational play therapists, and the toolkit of every single play therapist is the distraction box. So Rachel, what can you tell us about the contents of this distraction box and how it helps for painful and distressing procedures?
Absolutely. Well, the distraction boxes their aim is to be around where the play therapist isn't often around. So there's a distraction box in every treatment room and plaster room throughout the hospital, and they're filled with books and toys and colourful rattles and glitter wands, and the whole idea is to try and get the child's attention away from the painful procedure that's happening.
And does it help also for the older kids?
Not so much. There's some things that do get the older kids' attention, but they're mostly aimed at the kind of infants to toddlers to primary school age children.
And what would you say is your absolute favourite toy? What do you think works every single time?
Pretty much every single time I go to Bubbles. Bubbles works with lots of kids. I love looking at Bubbles, so most kids really engage with Bubbles.
Now, the play therapists are an absolute integral part of the emergency department because it means that the doctors and nurses can concentrate on the procedure at hand. It increases the likelihood of success first time, and it means the next time that patient may need a procedure, they're much more calm about what's going to happen. So can you give us an example of the Bubbles? Make sure that you donate on the Good Friday appeal so we can continue these wonderful efforts like the educational play therapists at the Royal Children's Hospital.